Hi, in this video we're going to talk about how does MS lead to bladder or bowel problems, what's happening in the body for bladder or bowel dysfunction to happen. Continence function is actually quite a complex set of events. Pathways are needed to communicate and coordinate nerve messages effectively for the normal function of the bladder or urinary pathways and the bowel and the digestive pathways. As is well understood with MS causes lesions or areas of demyelination of neurons of the central nervous system, but that being the brain and the spinal cord. This demyelination affects the signaling and the transmission of messages along the nerve pathways within the body, and this leads to many of the potential symptoms experienced with people living with MS. In a disease-free bladder pathway, when the bladder fills, it stretches and then sends electrical signals from the bladder or the muscle of the bladder muscle called the detrusor into the spinal cord, and then it travels up into the brain via the pons, and then it goes to the front of the brain. The top part of the brain decides whether the bladder has the ability to fill anymore, and if they think it does, then an electrical message is sent back down in the opposite direction, back down to the bladder, and the desire to pee is turned off and the bladder muscle, the detrusor, relaxes. If the top of the brain decides that the bladder is full and it needs emptying, messages are sent around the body and back down to the bladder to find a toilet. We manipulate our clothing, then we sit or stand to pee, then the body knows to relax the pelvic floor muscles. The two valves or sphincters that we have in the tube from the bladder to the outside world, the urethra, relaxes. Then the detrusor bladder squeezes and contracts and the bladder empties. Regarding the bowels, in a disease-free digestive system, the large intestine forms stools or poo by absorbing water from the waste that's in the large intestine, and the nerve messages create muscle contractions to help keeping that stool moving through the large intestine into the rectum for emptying. And this is done at a steady pace to prevent the stools from drying out. When the rectum fills with stool, it stretches, and then the electrical messages again go up through the spinal cord into the brain. And when it's ready for emptying, it's off to the loo we go again, and the valves or the sphincters relax and the body pushes out the stool. In MS, demyelinating lesions can develop anywhere along these pathways, really important needed pathways of the brain and the spinal cord. When these pathways are interrupted due to MS lesions and areas of demyelination, the communication required for bladder and bowel function can be affected, causing blocking or slowing or just disrupted nerve impulses and messaging, leading to problems with bladder and bowel control. For the bladder, these disruptions can lead to symptoms that affect storage, such as wanting to go to the toilet a lot more than usual, and that's called frequency. Gives you the sudden feeling of wanting to empty right now or like 5 seconds ago out of nowhere, and that is called urgency. And then also having to wake up 3 or more times overnight to go to the bathroom, which is considered nocturia. And sometimes with this urgency and frequency that you might have incontinence or accidents, which it is often linked with urgency with this set of symptoms. It can also affect the emptying of the bladder, where the coordination of all the working parts to empty the bladder are a little bit out of whack. There's a condition called DSD, or detrusor sphincter dysynergia, which just means detrusor bladder muscle, sphincter of the valves, and dysynergia is just another fancy word for uncoordinated. And so it's where you feel like you're absolutely busting and you rush to a bathroom and sit down on the toilet and not much happens. You've got hesitant flow. Or there's a little bit of a flow, but it stops and starts, and so that's intermittent flow. Or you need to push on your belly, or you do the wee dance to try and squeeze as much out of you if you can, and that's the need to strain. And sometimes you often leave the bathroom feeling like you haven't emptied properly, and so you've retained or you have retention, and because you can't get any more out. So this often leads to longer time sitting on the toilet. You might be in there for a little while, and as you do all these things to try and empty as best as you can. And this can exist in combination with the symptoms I said earlier. Sometimes the messages are blocked to the point that you don't actually get any sensation to go to the bathroom and have a pee at all, or you just pee very infrequently. Another sign of this problem is that you may wake up wet without any warning, or have incontinence or leakage through the day even without any warning. It just occurs. These are often signs of an underactive bladder, and it leads to overfilling of the bladder, and the bladder doesn't want to empty much at all, and so you end up with a lot of retention with that as well. And the leaks are reflective of some of it needs to come out of a path of least resistance, and so you often have accidents. When there's a problem of emptying, these symptoms can lead to increased risk of UTIs as well, urinary tract infections, and so this is another reason it's really important that you share with your healthcare professional if you're experiencing any of these symptoms that I've mentioned here, of any degree, and even if it's just one of them, or that you might think they're mild and you're managing fine and you don't really want to talk about it because I'm doing okay. It's really important and to understand the impacts of not following up on these symptoms. Education and understanding for you and your healthcare professional is equally important. You might not need any plans or intervention or changes right now, but it's good to know what's happening. And so if things can change, you can keep an eye on things, and you might need to consider management strategies down the track, and it's great to have a baseline to know where things are at the beginning. You can read more about how MS affects bladder and bowel in the patient booklet, Your Guide to Understanding Bladder and Bowel Wellness in MS, which can be found on the MS New Zealand website. This booklet was put together by MS Nurses of Australia and New Zealand with the support of Hollister.